Well, hello, everybody. Thank you for joining us today. My name is Emma Land. I am a counselor here at Williamsville Wellness, and today I'm joined by.
Steven Smith. I'm a licensed professional counselor at Williamsville Wellness as well.
Yes, yeah. So today we're going to be talking a little bit about trauma, and also EMDR specifically. Stephen is currently doing a training in EMDR. So I've had the chance to talk with him a lot about EMDR. We get to learn some of the nitty-gritty about it. So Stephen, tell me a little bit what piqued your interest in EMDR, wanting to do a training for EMDR, and then kind of trauma in general as a focus in your clinical work.
Sure. So I can start with the trauma general. Right? So, like, I feel like many things, I sort of fell into the trauma side of things. When I originally started working in the mental health field before I even went back for my master's, I was working in crisis stabilization, which is short term, but as you might expect with a name like that, there are a lot of people who have recently experienced or in the past experienced trauma with that. So I think it probably started there that I just worked with a lot of people like that. And then, fast forward subsequent jobs, working in addictions work as well as working with kids, adolescents, and families in intensive in-home counseling. A lot of times there's a lot of trauma involved with that as well. And I truthfully think I just started reading more about trauma from a place of trying to better understand it and think like, how do I work with something that I'm just seeing a lot?
Yeah.
And I don't know that I developed a particular fascination with it, but it's something that I just find to be really prevalent in the zeitgeist right now. And there are parts of it that I think are very interesting, but also very meaningful. Yeah, as a work. So that's kind of how I started to fall into it. And I mean, I had heard of EMDR, like even starting back to like early grad school days, where I mean, I was just trying to basically learn as much as I could, read anything that I could get my hands on, and any book, at least within the last I don't know decade or so, that has anything to do with trauma is probably going to mention EMDR at this point. And so I knew vaguely what it was. I knew its evidence base. I knew what it was supposed to be good for, but I didn't really know the ins and outs of like how it worked, what the protocols look like. And then at some point, I just decided to look more into the training. And then we're lucky enough that Woodville has been able to support me in starting training on it. So
Yeah, yeah. So in your initial phases of the training, what so far about EMDR has like stuck out to you since you've started this training and are reading more about it and were involved?
So I think the thing that stands out most about EMDR, both in the bit I've practiced it and certainly in what I've learned about it, is it's just very different than traditional therapy.
Yeah.
They often will, call it like talk therapy versus EMDR therapy, like, and it does look really different. Um, that is like probably the biggest thing that stood out. But also, I like that it's a very well thought out model that says like, hey, we are going to take an understanding of how we know trauma impacts people's brains and our nervous system, and we're going to have like pretty specific dedicated things, not just by way of skills to help people manage it, but actually what we're going to do in the therapy session that's going to help them reprocess, and change their associations and eventually their physical responses to things.
Yeah.
And I think that even though, both for like patients and newer clinicians like myself, there's a bit of an adjustment to like really getting used to, this feels really different. This maybe even feels weird. Is this really going to work? Once you get past that and into a place of a little more comfort with it, I think having a sense of like real direction with the trauma work is a really comforting thing to both clinicians and clients.
Yeah, right. Because I think the just topic of talking about for clients' trauma, their trauma in general, is something that maybe keeps them from pursuing therapy in general. Traditional talk therapy, just talking about the traumatic experiences, can be re-traumatizing if not done appropriately or certain parameters aren't around some of those sessions. So maybe people have had experiences in the past where they saw a traditional talk therapist and just, word vomited all of their traumatic experiences, and then they left like feeling worse than when they walked in, and their symptoms were heightened after that even. So EMDR being able to provide this nuanced approach, and it being as structured, I think, as it is, really can give hope to people who haven't had success processing their trauma in the past too. I think one thing too that I want to hear your thoughts on too, the misconception with EMDR about having to like know every single detail of your traumatic memories. That's what things that you shared with me that I was like, oh, I didn't know that you really don't have to know everything about or remember everything about your trauma to participate in the reprocessing phase of it. What do you tell me more about that? Like,
Yeah. So for people who are listening, in a broad sense, if I were to give a really brief attempt at an overview of EMDR, it's a pretty comprehensive therapy model that's got lots of phases. And the early phases are going to be dedicated to just basically assessing, is this person really going to benefit from EMDR? Get a sense of how has trauma or other past events impacted the present? What is the problem that we're trying to solve here? Identifying the targets. And then making sure that they have the necessary like coping skills basically to tolerate the level of distress or any other emotions that might come up, or I should say will come up during the actual reprocessing work. The reprocessing, that's the R in EMDR, is kind of what it's most famous for. This is where you are going to be talking more about specific targets or traumatic incidents, things from people's past, and processing that by using some bilateral stimulation, which is most commonly going to be eye movements back and forth to help people's brains reprocess and form healthier to positive, or even just more adaptive associations with that stuff. And so what I think, and this is true for me too, going into the EMDR training, my assumption was that EMDR had this reputation for being something that works faster than a lot of other, therapy models, but that might mean it's going to be really intense and you're going to have people saying everything and diving in deep and doing these eye movements. But the reality is, and what the EMDR Institute teaches is that when you're actually in the reprocessing sessions, what that looks like is you have identified this target, and there's a whole protocol that I will, go into complete detail with. But we start with that target, and we tell clients to focus on that, or just start there, and we're just going to start eye movements, and it's going to be silent actually at that point. They're just going to be paying attention to images, emotional sensations, physical sensations that are coming up for them. We're going to do these sets of bilateral stimulation, and then we're going to pause. The metaphor that the Institute uses is it's almost like you are on a train. We're going to start. They're going to go into the next stop. They're going to see whatever they see, feel whatever they feel. Whatever's going to come up is going to come up. We're going to stop. We're going to pause. And then I'm going to have them just really briefly, actually, just share what came up for you or what are you getting now. And it's actually even encouraged to clients to not go into like an intense amount of detail. They might say, well, I started thinking about this one incident with my father as we were doing the eye sets. The image changed a little bit and I started to see him in this different way. Okay, that's great. Now we're going to go from there and we're going to continue the eye sets. So people will often internally be experiencing a lot of detail. They're going to be noticing specific memories that they hadn't remembered. Maybe intense emotions are going to come up. That's going to be going on internally for them, but it's actually not essential that they then verbally say that out loud to me because the reprocessing is going on up there.
Right. Yeah. Yeah. And I think too, something I love about EMDR is its like main goal seems to be like reconnecting brain and body. Because when we go through trauma, brain and body is completely disconnected. The way we store trauma in the body and the survival mechanisms that kick in when there's something that reminds us of the trauma. Like, I'm not thinking anymore. It is all survival mode. Like I am just doing what is my knee-jerk reaction. And EMDR is like almost having the brain comfort the body. Sometimes that's how I look at it, of like, no, we can work together and we can know that even though maybe this thing reminds us of that time from the past, it's not that thing from the past. That I am here right now in this present moment that looks so different from the trauma that I experienced. How do you find clients feel comforted in that type of mentality, that I'm in the present, I'm not where I was, that as they start to connect in that way?
Yeah, so I think that that's like really an essential piece of. I mean, I wouldn't say that's specific to EMDR, but it is really essential to it.
Yeah.
And part of that is going to be in helping people with the foundational skills work. Um, First, people have to be connected enough with their emotions and like their physical body that they can recognize when they are even in a state of distress. I think that that is probably a broader trend in like modern therapy, and I think a really good one. I say this as someone who like would not really have, several years ago assumed that I would be, learning as much about or incorporating as much like physical sensation talk into therapy. But I mean, when you think about it intuitively, it really makes a lot of sense. Like, I mean, people can say emotionally, oh, I'm anxious or I'm stressed. But if we really break that down, like, how do you know when you're stressed? I'm like, for me, if I really tune in or really pay attention, like, I only am labeling myself as stressed because I can feel that like my jaw is clenched and like my chest is tight, or like I'm recognizing that I'm anxious because like my mind is bouncing all over the place and I'm tapping my foot a lot. So these are silent associations that we make in our head, but helping people make them conscious is really key, because a lot of times, especially when people have experienced trauma, they may not really know that they're experiencing distress. What they're seeing or maybe even noticing is their own reactions to that internal state. So they're seeing an urge to perhaps use some kind of substance or an addictive behavior, or they're seeing or feeling themselves kind of like shut down and not want to talk to anyone, but they're not really noticing any other sensations beneath that. So we got to help them connect with those first. And then we want to help them basically learn, like, I mean, how can you, now that you're aware of that, tolerate that and stay with that? Which is really key, again, for the piece about like the distinction between the then and now that you brought up. Because when we get into doing any kind of deeper trauma work, certainly if we're doing it in the way that EMDR does, what's really important, actually, EMDR, their principle they call us is dual attention. So being able to have dual attention, part of our attention is on the past, on the memory, on the thing that we're reprocessing, and another part of our attention on the present, in the room with me, the therapist, with me doing the bilateral stimulation right now. That is partially how it works, because if we had all of our attention on just the past piece, they would just be reliving the traumatic memory. And that is often unpleasant and not really all that helpful. So we need a part of our attention in the present, one, to keep us stable, but also in the present is where now we can be making different associations and say, hey, maybe as I have gone through weeks or months of reprocessing, a part of me is starting to think that the meaning that I ascribed to this traumatic event's not the same as I once did. So it is really important. And I'd say it's comforting to the clients in that it's kind of grounding. It keeps them still in the moment, as opposed to just having to basically tell this person who's sitting across them and relive anything that was really terrible for them.
Yeah, it's like putting those safety measures on therapy, like giving them opportunity to talk about those things, look at those things in a very safe, comforting way. And that's, like you mentioned, that skill building piece being so important. Actually having those grounding skills at easy access for when going through this in the therapy room and outside of the therapy room, right? Like when something just triggers you in the day-to-day, having that access to the skill that will help you get through that moment, right? Or not get rid of it, just get through it and show you that, look, I can get through it because I'm here and I'm not back then. And I know, correct me if I'm wrong, EMDR originally came from or was targeted towards like PTSD and combat veterans, or is that what it originally studied?
So some of the earliest like randomized control trials that showed strong evidence for its effectiveness were done with PTSD, and I may be wrong about this, but I think the majority of those people often were veterans. But I mean, other studies got then done about single event trauma, like related to natural disasters and other stuff. So it's not just I got PTSD. But yeah, I mean, I mean, in terms of how it started, I mean, Francine Shapiro, I think in the 70s or 80s, like she's got this famous story of her in graduate school just being really stressed, and she's on the walk.
Yeah.
And she just found herself scanning, eyes moving back and forth for surroundings, and noticed that there was a relaxing effect. And that kind of sparked her just basically seeing, hey, did these eye movements help relax people? It was originally just seeing, is this going to help, reduce, stimulation? But, several more studies happened, and suddenly it became a much more comprehensive thing. But yeah, some of the earliest evidence for it was around PTSD in particular.
Yeah. Yeah. And another thing I hear often about EMDR is that it is more effective for single event trauma than maybe more of like a complex PTSD. How true is that? And what have you heard about that in your training so far?
So what I have learned so far is in terms of like its evidence base, people will often say that it's stronger for single incident trauma because I believe that some of the earliest studies were done on that, and there also have just been more randomized controlled trials done for single incident PTSD.
Yeah.
When we talk about complex trauma, the tricky part with that is that like I think it's now a bit more of a widely accepted term in the field.
Right.
But when it comes to actually like a DSM diagnosis, there is no DSM diagnosis for complex PTSD. And I think in part because of that, there are less specific studies that says, hey, let's study how EMDR works with complex PTSD.
Right.
But what I have learned in the EMDR training and the treatment manual is that there is evidence for its effectiveness in working with trauma as just a broad spectrum. There are specific considerations that we're taught to take into consideration. And, as you can imagine with the name, complex trauma, there's going to be more factors at play.
Right.
You probably are going to have a more individualized treatment plan. Other things are going to come into it. But no, there is evidence supporting the effectiveness with it, with that as well.
Okay. Yeah. What would you say to somebody who is considering like wanting to do EMDR therapy or wanting to know more about it or wanting to know if they could potentially benefit for doing EMDR?
That's a good question. I think that like first what I would say is really at the most basic is like if you are considering, whether you might benefit from it, I would just encourage you to like do your research for therapists in your area and like do a consultation call or try to just get with a therapist who's an EMDR therapist.
Yeah.
Because ultimately, one, they're going to be able to like explain the process more to you, but they're also going to get to know you and do a lot of that assessment work, and it'll be a collaborative process. I have been surprised in my training so far that I think the breadth of EMDR's coverage and like what there is even, more growing evidence for what it can be used to treat is honestly wider than I thought. But it's a very collaborative, endeavor. Clients who want to do it usually are going to be a part of the discussion of like, what do I want to do it for and all of that other stuff. And that discussion, I think, is just best served with a therapist that you might actually do it with. One piece that I would say to people is that I think that EMDR, because it has a reputation for being very different, and I think because it also has a reputation for being quicker than other modalities of therapy, maybe sometimes people think I'm going to go to this EMDR and I'm going to do these eye movements and it's going to resolve it.
Yeah.
And what I would say to that is that like, one, there is no specific timetable.
Right.
As much as we would love to, I think, manualize and protocol any therapy, some stuff, it's just going to take different time for different people. Yeah. And it's really important to not skip steps. And your therapist, if you do this with them, will know this. Yeah. But they are going to do work on really identifying where are we going to start? how are we going to understand what's been going on? What are these different past and present things that are contributing? That's going to take some time. And so people need to have, I think, maybe some patience, and maybe not this expectation that they need to rush to the eye movements and the actual reprocessing.
Yeah.
Because if you were to try to do that, to be honest, if you don't have the skills basis, or you rush to that, at best case scenario, the reprocessing is just not going to be effective. The associations aren't going to form because you haven't done the groundwork. Worst case scenario, it might be a little overwhelming, and it might be a little more distressing.
Right. Yeah. Yeah. And I think that is something that I've heard maybe in a patient's experiences, previous experiences with the MDR, is that they were, well, I never even got to the eye movement part because we just kept focusing on these other areas, and I just stopped going, or really going in wanting to just jump right into the eye movement part and then not coming back because a therapist who is EMDR trained said, no, can't do that, would you do it this way? I know you and I have talked about the different steps you go through, and seeing that the actual eye movement reprocessing part is pales in comparison to every other step that's within EMDR, the lead up and then even the aftercare part too. What about the post reprocessing, the stuff that is focused on in the therapy room after maybe some of the eye movement reprocessing, desensitization has happened? Really, do you feel like is, and it's all important, but is of most importance?
Yeah. So, well, I think if I heard you correctly, it's like, what happens after the reprocessing and what's important? Yeah. So, another piece that I think I have learned a lot more about EMDR, and it probably has even come across this way in the conversation so far, is that a lot of the emphasis seems to be on reprocessing past events. And that's a key piece of the model. I mean, there's no getting around it. But it actually is very comprehensive. EMDR really looks to address past, present, and future, as they say. So we're looking to understand how the past has informed our present reactions. We want to understand what in the past is, still maladaptively stored in my memory networks that is making me triggered or respond this way in the present. And the idea being that if we're going to start with the past and we're going to reprocess some of that, and that's going to start to trickle forward. But there's actually work that we're going to do with people after and in addition to that on the present and the future. So we're going to look at, okay, so as we're kind of assessing the progress that we're making as we're going through these past events, we're going to be checking back in on how are our folks, handling present triggers now.
Yeah.
How, do they even feel in the room when we talk about a present triggering situation? Do they feel the same or different as they did? And then in terms of the future, we're going to be looking at, like, how do they want to respond differently now that we have sort of reprocessed some of this? And those are just broad questions. I mean, EMDR has protocols that are going to actually look at, like, exercises, for instance, a future installation template. Once we've reprocessed successfully, we're going to be talking about and walking through in much more detail how you would like to respond. We might be having you imagine or think about those incidents. We're going to be actually using a different type of bilateral stimulation to help enhance or reinforce that. So there are more technical pieces that go into it. But basically, I would say that all of that present and future work is also important. The reprocessing I like to think about as, like, we're helping sort of people break or sort of free themselves from the automatic reactions that have been locked in there from the past.
Right.
That doesn't automatically guarantee that things are just going to resolve, right? It's just sort of now we're back in a place of choice. How do I want to respond differently? How would I like to feel differently? What would I like to believe differently? And that's going to take some other talk therapy work, as well as some of, like, the EMDR future template kind of work.
Yeah. I had one more question. What to you, when you're just starting to work with a patient or a client or an individual, what to you is kind of one of the biggest tells that someone has experienced trauma? Outside of them maybe just sharing with you an event that sounds traumatic, what is the thing where you're almost like spidey senses start tingling and like, I think there might be some trauma here?
And, well, I could think of a couple ways I could answer this. Do you want me to answer this from the realm of, like, what am I paying attention to, or what do I think might be helpful to people who are listening, out there, in terms of what they might notice within themselves?
Maybe the second.
More so the second.
Yeah.
Yeah. So, I mean, I think that like there takes a degree of self-awareness with this, but other people in our lives also can be a help with this. If there are sort of recurring themes or triggering things, and I say that with acknowledging that the word trigger is really broad,
Yeah.
but by that I mean like something happens, or a person in our life, or a way that we're spoken to, or a certain emotion, anything specific that when that happens, it really tends to elicit like a specific and maybe even intense emotional response.
Yeah.
That could be something like, when someone talks to me in a way that feels controlling, I find myself getting so angry. It could be all the way down to, when someone questions me about something, I feel myself just like shut down and I don't want to speak. I don't want to talk to anyone ever again. So there's a wide variety, but like if you find yourself saying like, I'm noticing patterns, I see myself responding kind of in a similar way, emotionally, physically, behaviorally to certain things, that might be a signal that like there's some kind of template that might be contributing to that. Um, Trauma, we could probably do a whole nother talk about just like definitions of trauma.
Yeah.
But so I'm speaking broadly here of just like that usually tells me that like it might tell people that, hey, I've experienced something or some things in my past that are probably informing
Yeah.
in some way how I'm perceiving this or how I'm responding to it, for better or for worse. Um, so a little bit of it I might just say is pattern recognition. Other things that I might say is just like, I ask people sometimes like, how do they know when they are like calm, when they are at peace, or when they are centered? Any of those kind of words. And how do they know when they are not? What are the other options? And if you're someone who says, when I really think about that, I don't know that I know what calm feels like, or I maybe know a little bit, but I really don't feel that way very often.
Right.
That might be a signal that like there is some kind of physical nervous system dysregulation.
Yeah.
And even if you don't know all the specifics, I think that might be a signal that like, hey, there might have been some things that have impacted you in some way.
Right, that have almost elicited this chronic stress and worry and like heightened sense of being. Yeah. But yeah, we definitely could talk about this for hours, and it will have to do part 2, 3, 4, etc. Because trauma is that topic where there's so many avenues we could go down to continue talking about it. But I appreciate you sitting down with me and talking to me more about EMDR. And for everybody listening out there, thanks for tuning in, and we'll see you next time.